This short presentation will introduce you to the electronic grading system that we currently use at the college. The EMS system is designed to manage rotations, grading, scheduling, preceptor availability, site descriptions, and evaluate the students on professionalism and their competencies. Our students also evaluate the preceptor and site for each rotation. This allows us to provide our preceptors with an overview of all rotation evaluations at the end of the year. You can obtain more information about our program, the IPP workbook, evaluation forms, etc., by going to our website listed at the top of the page in the slide. Click on Preceptors to access the program information. Note that you can click on Introductory Pharmacy Practice Experiences or Advanced Practice Experiences, as well as link directly to the EMS system. Once you enter into EMS, you will need to log into the website using your first and last name with a period in between. You then enter password with a capital P. Once in the system, you'll be directed to change your personal password. Once you have changed your password, you will continue to use this every time you enter the system. We do not keep your personal password on file. If you forget your password, simply contact us to reset it back to the original password with a capital P, and you can change it then again to one of your personal passwords. The system will automatically tell you that you have successfully updated the password. The information you have provided to us will appear on the affiliate profile. Site information can be viewed by the students. Information that you provide as confidential will not be available for student viewing. So your home address, cell phones if you tell us you do not want to be contacted by cell phone, etc. You will also notice a column on the left-hand side which lists the various areas that you can enter. We do not use the activity logs. If you select any one of these and click on it, it will take you directly to that page. Notice that the rotation that is circled. Clicking on this will take you to the slide that shows you, and the program that shows you the students that are coming by name. It will also show you that you can click on 3 different areas: the absence, resume, or contact the student directly using this email link that's provided. If you click on Forms and Documents, this will take you to all of the forms that we use in the EMS system. These are optional and required forms, and we are separating them. We're doing that now, and you'll notice when you open this in the future that these will be separated into these 2 different sets of forms. We will also be putting in forms specific to the IPPE program that you can find specific for your program. If you click on Evaluations, that is going to take you to the screen where your student will be listed, as well as the rotation type, either IPPE, you'll see the community, or you'll see IPP institutional. There'll also be an initial student evaluation. It says a self-evaluation. This is what you will view that will show you the different areas that the student has self-assessed them on their competencies that they'll be completing in the rotation. And that'll indicate to you the areas that the student feels comfortable or needs more attention throughout the rotation. You will also notice a preceptor and site evaluation that the student completes at the end of the rotation. This is available for you to view once you have completed and submitted the student's grade. Please remember to click on Save as a Work in Progress when you do the midterm evaluation for the student. In the event you accidentally click on Submit, just please contact the school and we will reopen the evaluation form for you. When you click on the student's name, this is the evaluation that you will see. There is a professionalism assessment form that assesses their professional attributes, values, and behaviors, as well as competencies that you'll grade them. Please note that all evaluations are done in quartiles. the increments of the 0.25. Please also note that all students must complete either the professionalism and the competency that you're grading them on each section independently by a 3.0 or better to pass the rotation. The grade that you assess the student in the professionalism will automatically go into the competency evaluation form. And then you will have the individual competencies to grade the student on, and then the grade is automatically computed by the computer. The patient drug-related problem is a required intervention form that the students need to complete in all rotations. The form is available in the EMS for the student to complete, send to you for review and comment, and then submit to the EMS. The student cannot send the DRP form directly to EMS without your review. Only the preceptor can send it to EMS. Students in IPPE must complete 2 DRPs during the semester. When you select the patient drug-related problem, this takes you to the screen where the student, you can see it to view your student's drug-related problems. If you click on that view, you will see a screen that says it has your student's patient drug-related problem forms filled out. Please note that the student has only uses their initials to identify the patients. We don't use any patient initials. We totally de-identify any information that goes into the system. The one that appears after the student's initials, and that would stand for TS for test student, the one that'll be a 2 or a 3 depending on how many they put in the system, they simply refer to the order that they were put in. This is a view of the drug-related problem form. There are paper copies of the form in the student IPPE workbook at the end of the book that the student can either fill out by paper and then put them on here or put them directly in here. Students can view the preceptor, this is their view, their rotations, and you'll notice that the information, if they click on the preceptor directly, it'll take them to your adjunct profile that we've listed in there. If they click on the information here, you will notice that this takes them to an information preceptor in site with the address, the phone number, and very important to notice that they also get a get map feature where they can actually see where exactly your site is if they're unfamiliar to the area or to the site. When they clicked on the preceptor, they will come to your affiliate profile like I mentioned, but they will not be able to see the confidential information if that's requested by you not to be shown to the student. Thank you. I want to, this is a very important part. It's new for the IPPE preceptors, and we certainly appreciate everything that you do to help us to educate our future pharmacists. If you have any problem logging in or working in the EMS system, please contact us. Manuel Temez is our program coordinator. I am Beverly Toledo, the Associate Dean for Clinical Programs, and Mr. Freck is our IPPE program director. So please contact any one of us. The information for us, we are in the workbook, all the information, even the associate administrative assistant and our Cordy, who is our pharmacy assistant as well. So please do not hesitate to contact us because we know this is a change for you, and we certainly appreciate your help and willingness to do this. Thank you.